I started out as an occupational therapist in the mid-70s and loved starting at the bedside, taking care of patients and learning about really the catastrophic experience of a patient and a family in a hospital. So for me, I learned from the bedside up, but I also learned that I was better at management and leadership. So for years, every time someone left a job, I would offer to take their department and say, don't pay me any more money, let me take over psychology or the alcohol treatment center or whatever it was. When I took over as the CEO of Catholic Medical Center, we were in a very difficult position because the community thought we were going to close, and they said, we're going to save this hospital. And for 2 years, I would say, these employees would say, we'll walk over hot coals, whatever we need to do to bring this hospital back, we'll do. It was the easiest job as a CEO because they could also say, we don't really know what a CEO does, but what we know is if we don't have a good one, things are really, really bad around here. And now we know that we have a good one because things feel really good around here. We still don't really know what you do, but we know that the place is alive and vibrant and we're excited about it. And it was enormously gratifying. My goal is to be visible, to be supportive, to try to provide the best working environment I can, the most understanding and supportive environment, and respect for every single person in the organization. And I meet every new orientee, and I shake their hand and have them talk to me and say, your job is to carry on this culture and to make the patient the center of everything you do, and to know that you can make a huge impact on that patient's life and their experience. And even the high school kids that are kind of slumped in the back who are going to work in the kitchen, sit up and realize that when they deliver the tray for dinner, they can have a big impact on that patient and family's experience. And that's probably the most fun that I have in my job. The Mom's Place is probably one of the parts of our organization I'm the most proud of. When we were merged, first thing that moved away from here were all pediatric and maternity services. And nobody thought we could bring it back because there's a big, big program at our competitor hospital. So we did focus groups with women. What they wanted was a country inn. They wanted bathrobes, and they wanted to feel as though they were the center. They were the ones in control of the birthing experience. It's been wildly successful. We went from 0 to now 800 deliveries a year, which is more than we've really ever done here. And we hear nothing but positive feedback. And we've even thought we may use the same model in some other areas of the hospital for women's care. Now we've gone through and realized we now need to build 10 new state-of-the-art operating rooms. They're too small, they're undersized, they're circa 1978, and we're doing cardiac surgery, and we really need to have more space. So we're underway with that new project. I guess the most important thing is that they have good emotional intelligence, good people skills, and they have a positive attitude, and that they've got to love every job they have along the way. Because if you love what you do, you're seen as somebody who can do more. You've got to be willing to try to do things that you don't know how to do and be willing to take on stretch assignments. That you've got to always be respectful and I guess maintain your humility. And I have a daughter who's a junior in college who wants to go into healthcare. And what I've said to her is, go out and volunteer in organizations, not even necessarily healthcare organizations, but go volunteer, and she actually did for the Red Cross. I would absolutely encourage her to look at an MHA program that would provide her with not only the great education and fund of knowledge, but a residency program.
This program is brought to you by the American College of Healthcare Executives, an international professional society of more than 30,000 healthcare executives who lead hospitals, healthcare systems, and other healthcare organizations. The leaders of the featured hospitals and health systems are board certified in healthcare management, having become fellows of the American College of Healthcare Executives, signified by the FACHE credential following their names. For more information, go to ache.org.